Hi, this is Dr. Kim, and this is Dr. Chen from Singapore, my awesome visitor, who is also an aesthetic medicine doctor. So, tell us a little bit about yourself. I think you were in internal medicine or family practice and decided to go into aesthetic medicine?
Yes.
Okay, and when did that happen?
2 years ago?
During the COVID crisis, right?
Yes.
During the fun-filled pandemic, right? So, anyway.
Okay.
Anyway, I know that there are differences in Singapore with like non-invasive stuff or less invasive stuff. With neurotoxin, what are the more common things or common areas that you do that are maybe a little different than in the West or in the US?
I think most of the people, like my patients, they want to do for the upper face, like for this forehead and the glabella and the crossfeet. Yeah, there's less people who are concerned about like for the lower face or for the necklines.
Okay.
They'll choose to use fillers
instead. Okay. And then the other thing is that I know it's more common in Asia, and it's actually common in the US with not only Asians, but people who have problems with the TMJ, bruxism or clenching of the jaw, to give it here. Now in Asia, it actually makes a wide face a little more V-shaped. So that must be relatively popular in Singapore.
Yes,
Yeah.
it is.
Okay.
Yeah.
Now, in the US, there's definitely a trend towards giving neurotoxin like all over the place. So specifically like in the under eye because the orbicularis oculi sphincter, to give it in the platysma fold area so that the muscles that sort of bulge here can be relaxed. Is that becoming more popular as well?
I haven't done that yet, but we have this technique that we actually use the neurotoxins to mix with some skin boosters. Then we do micro Botox for the entire face.
Gotcha. Okay.
But that's only like 20 units, so it's a small amount of Botox.
Now, I know that we have fillers in the U.S. We actually have a limited number of fillers, so there aren't that many. The big names, of course, are Juvederm, Restylane, including Merce Aesthetics, RHA, things like that. How many fillers do you have in Singapore?
Oh, I think there's lots of options, but the clinic I worked with, I have used like Restylane and the Teoxane.
Yes.
Yeah.
Teoxane is Teoxane. I think it's Teosil. That's the
RHA 4-3 and RD 1-2.
Yeah. So in the US, there's only RHA. So specifically, there's a limited number of products from the Teoxane company, and they're resold through Revance. And they want to get more FDA approval for more products. We don't have the whole portfolio of products like you guys do in Singapore and Europe. So what are the more popular areas or different areas in Singapore compared to the West or the US?
I think lots of young people concerned about their tear trough.
Right here.
Yeah. So, and like for the girls, sometimes they like to do nose or chin fillers. Yes.
Profile balancing.
It's easier.
Yeah.
Yes, it's easier.
Okay.
And no downtime.
I see.
Yes.
And then in terms of less invasive or non-invasive technology, in terms of skin tightening, what are the more popular things in Singapore?
So we have HIFU. High intensity focused ultrasound.
High intensity focused ultrasound. Yeah, HIFU. Yes.
Like Althera and Ultraformer. And then we have RF.
Yes, RF, radio frequency.
Yes. Such as Sci-Fil. What else? Morpheus 8. And Potenza.
Yeah, Potenza is a different radio frequency.
Yes.
Yeah.
Yes.
And a lot of it's radio frequency with microneedling, RF microneedling.
Yes.
So one thing I learned from you, which I find very interesting, is that PRP is not allowed in Singapore.
Yes, unfortunately. It's illegal.
Yeah. Yes. So even though, you could take out your own blood, centrifuge it, process it, and create PRP, you can't do it in Singapore.
No.
Okay. Any reason why?
I think there's not enough RCT studies to show the safety of this use.
I see.
Yeah.
Okay.
It's allowed to use for a knee joint.
Yeah. Another thing I've learned is the way that your forehead looks gives you advantages in Chinese culture. Is that correct?
Oh, yeah. I think if you have a full dome-shaped forehead, it means that it's more auspicious in terms of you will have a happy life and a good marriage. So
what change in the forehead do I need to make or do people make so that I can have a more auspicious life?
So it's both like bilateral temporal area.
Temporal area.
Yeah, and the glabella. I already have some volume loss here.
Yes.
Yes.
So I need to get filler here, and I need to get filler here and here.
Yeah.
Now, if it goes and bulges out like this, like I look like a space alien,
yes.
that would even be more sexy
so
in China.
cool.
It'd be cool.
Yes.
Okay, so maybe you could do that for me while you're here.
Are you sure?
I mean, I want an auspicious life. I want, better marriage. I want to have
Your
five
forehead
better.
Is very full
Five
now.
better. My forehead's huge. Is that what she's saying? So anyway, yes, I know my forehead's full, but it could be fuller, right?
Okay.
So you can have a better life. 10 or 20 marriages down the road, they're all going to be awesome.
How long are you planning to live?
200, 250.
Wow.
I mean, I'm already like 110 now. I just look younger due to plastic surgery and all the treatments I get.
So how old are you?
I can't say that. So you're killing me here. Anyway, what else? I don't think I have any other questions. Do you have any other questions for me about the filler neurotoxin non-invasive market here in the U.S.?
No.
Okay. Well, thanks so much for showing up. Thanks so much for joining me here on video, and hope you enjoy your time in the U.S.
Yes, I do. Thank you very much, Dr. Kim.
Thank you.